good evening. My name is Amanda, and I will be the student nurse taking care of you today. Can you please state your name and date of birth for me, please? Madison Wade, 3905. I'm just going to take a look at your wristband to verify, and it looks like that matches. Thank you. I need to ask, do you have any allergies, such as to substances like tape, latex, and chlorhexidine? No? Okay. And are you in any pain or discomfort at all? No? Sounds good. So, Miss Wade, today I will be doing your CVAD dressing change. Have you ever had this procedure done before? No? That's okay. I'll be here to educate you and guide you through the steps as I go. So, CVAD stands for Central Venous Access Device, and it is a catheter that goes into the left side of your chest and goes straight to your heart. And the dressing change that I'll be doing today, it is a sterile procedure, and which is important because we need to prevent any infections from developing, as well as CLABC, which stands for Central Line Associated Bloodstream Infection. And as I do this dressing change, it should be fairly easy and painless. I think the most pain you'll feel is a tugging sensation on your chest as I remove your old dressing. So now I need to prepare my workspace. Do you have any questions before I get started? No? Okay. So I'll be doing another round of hand hygiene for 20 seconds, and then I'll put on my first pair of clean latex gloves. And then with my wipe, I will be sanitizing my workspace for a full 30 seconds. How's your day going so far, Miss Wade? Okay, that's good to hear. Has anyone visited you while you were at the hospital today? Your girlfriend? Okay, that's nice to hear. I'm happy to hear that she's been a good support system while you're here with us. I'll just need a few more moments to finish disinfecting my workspace. And now that my workspace has been disinfected for 30 seconds, I will be discarding of my wipe and taking off my latex gloves. I'll perform another round of hand hygiene for 20 seconds, and my workspace will need to dry for 2 minutes. So, Miss Wade, I will be educating you on what I will be doing today. Like I said before, it is a CVAD dressing change, and per our hospital's protocol, we do these changes every 7 days to prevent the aforementioned infections and CLABC. And like I said, it should be pretty easy and painless. The most pain you'll feel is the tugging sensation I mentioned before. Now that my workspace has dried for 2 minutes, I'm going to get my sterile field kit ready. Do another round of hand hygiene for 20 seconds. I do not need this mask, so I will just be dropping it over here. And I will take out my pair of sterile gloves, which I will need for later. I'll do another round of, and then I also need to drop my bio patch in. And it should land blue side up. And I got lucky, it did. I'm going to drop this down. Another round of hand hygiene for 20 seconds. Sorry. And then, Miss Wade, you may have noticed that when I walked into the room, I was wearing my mask, and you're wearing your mask as well. And the reason for that is because we want to prevent any contamination of the insertion site from particles from sneezing or coughing. And while we're on the subject of sneezing and coughing, as I do this dressing change, I'm going to ask that you turn your head to face me, since your site is on the other side of your chest. So can you please go ahead and turn your head to face me? Thank you. And then I'm going to do another round of hand hygiene for another 20 seconds and put on my next pair of latex gloves. And then would it be all right if I lowered your dress so I can inspect the site? Okay, thank you. Let me go ahead and lower your dress. Okay, so let me take a look at the site. I don't see any redness or swelling. Do you feel anything such as itching or discomfort? No? Okay. I don't see any leakage. The catheter itself does not have any cracks, and the cap is still intact, which is good because it prevents blood from leaking out and air from going inside and therefore causing an air embolism. And I see that the catheter length is the same from what was previously documented, so which is good to hear. And then now I will be removing the old tegaderm dressing. Like I said before, you will feel that tugging sensation on your chest. So if it ever gets to be too painful or uncomfortable, let me know and I'll be more than happy to give you a break. So I'm going to grab the end of the catheter with my one hand here and start removing the tegaderm dressing. Just give me a few moments as I peel the rest of this dressing off. Are you doing okay, Miss Wade? All right, that's good to hear. I am about halfway done. Just bear with me for a little bit longer. The tegaderm is being a little bit stubborn with my gloves. Just a little bit longer, sorry about that. Right, now that the bio patch and the dressing have been removed, I'm going to discard them off to the side. And then I'm going to set, oh, there's a little bit more right here. I didn't even notice that. Then I'm going to set your catheter down. That wasn't so bad, was it? Okay, now I'm going to take off this pair of gloves. Do another round of hand hygiene for 20 seconds. And then I'm going to put on my pair of sterile gloves. And I'm just going to adjust the cuffs of my sterile gloves. Now my sterile gloves are on. I will be discarding of the wrapper. Right. And then I am going to grab my tegaderm bandage that's inside and fold a lip. Like so. I'll set that back down. Now I'm going to grab my chlorhexidine sponge and crack it. And Miss Wade, I will be using this sponge to sterilize the insertion site as well as the catheter for a full 30 seconds. And then I'll be scrubbing a 2-inch border around the sides from in to out. So I'll grab the catheter with my non-dominant hand. It is now my non-sterile hand, and I will begin cleaning. And I will also be cracking the chlorhexidine sponge, and I will start cleaning now. Now I will be cleaning in upwards motions for the catheter. 1, 2, and 3. Now I will be discarding of the chlorhexidine sponge, and I will let the site dry for another full 30 seconds. And then now that the 30 seconds have passed, I'm going to grab my biopatch from the sterile field kit. And I'll be pinching it like a taco and fastening it around the catheter. You doing all right, Miss Wade? Okay, now that that's done, I'm going to grab the tegaderm again. So now I'm going to peel the backing of the tegaderm bandage. And then I'm just going to let that drop right over here. And then I will be making the stress loop. And now I'll be placing the tegaderm bandage on. Right, let me just smooth out any air bubbles. And now I will be taking out the tape border. And I will place to the side right over here. Now I will go and reach in and grab tape and fasten the end of the catheter to your skin. Discard the tape here. Right, and then now I'm going to grab my pen and note today's date, the initials, as well as the time. And I'll be removing that tape. And I'll fasten it to the end of the tegaderm bandage. All right, how did that go for you, Miss Wade? You doing all right? Okay, now I will be cleaning my workspace. And Miss Wade, I will please go ahead and turn your head back back forward, please. All right, I've discarded my sterile gloves. Do another 20 seconds of hand hygiene. And would it be all right if I put your dress back up? Oh, before I do that, I need to inspect the site. There is no redness or swelling. Are you feeling any itching or pain? No, the catheter and the cap are still intact, and the catheter length is still at what was previously documented. So now would it be all right if I put your dress back up? All right. Right, so now that I finished the procedure, Ms. Wade, I will be documenting that the length of the catheter has stayed from what was previously documented, that you had no itching or pain, that you tolerated the procedure well, today's date and time, and that upon my assessment of the site, everything looked okay. And then, and that the length of the catheter was the same as what was previously documented. Do you have any questions before I head out? No? Okay, so I'm gonna put your bed in the lowest position, raise your side rails, here is your call bell. Feel free to hit that whenever you need anything, okay? I'm gonna do another round of hand hygiene for 20 seconds. Thank you for your time, Ms. Wade.